Hello and welcome to Therapist Corner with Sharia Farmer and
Alexis Frederick Bowie.
And we are going to take this opportunity at least once to twice a month to kind of go over some of the topics that we are going to talk about in a formal sense with training, but really kind of making it very casual and how a therapist may talk about it with a client or with each other. And so today we're going to do the subject of consensual entanglement, navigating ethical non-monogamy in relationships and in practice. So obviously the trainer for that is Alexis. And so I'm going to interview and ask a few questions and we're going to take it from there. And again, if you are not already subscribed to our channel, please like and subscribe to our channel. If you are not a member of our RS Virtual Academy and you are a mental health professional, you are missing out on an awesome opportunity to have a buttload of courses for $99 and also including webinars that we do each month, which will be one on the subject of non-consensual monogamy. All right. Or consensual non-monogamy. There we go.
It's a mouthful.
It is. And so let's start with, can you give us a formal definition of consensual non-monogamy?
So when we're talking about consensual or ethical non-monogamy, but it is also referred to as consensual non-monogamy, we're talking about the agreement between partners that they are going to have multiple partners or other partners outside of that primary or exclusive relationship.
Okay. So, and when we're asking, I guess my question would be, does that mean that it has to be a sexual relationship?
No. So that's a great question, because sometimes when we think of relationship, we do think of it only in the sexual capacity. However, there are other ways to be intimate with people. So some people have partners for romantic reasons. Some people have multiple partners for emotional reasons. And then, of course, some people do have multiple partners for physical or sexual reasons.
So if I'm someone who is a therapist working with a client who comes in and expresses their interest and maybe expanding beyond monogamy in terms of having a one-on-one relationship, how would we discuss that in the therapeutic setting?
So if I had a client that was coming in wanting to explore or possibly explore non-monogamy with a partner, the first thing is definitely education. So educating and definitely being curious with that client about, well, what is going on for you in your current relationship? Or if you are monogamous, what is going on in that current relationship where you feel the need to have multiple partners? So first exploring that, deciding what type of non-monogamous relationship that client would like to explore or experiment with, and then giving them education or providing them with resources on what that specific community is like. And then definitely having and practicing with them how to communicate that with their current partner.
Okay. So I guess that brings us to the question of communicating it to your partner, which was going to be the next question that I had anyway. What are some of the best practices when communicating it to or with your partner?
Definitely honesty and transparency and knowing the difference between those. Communication is definitely the bedrock of non-monogamy. It's the bedrock of all relationships, really, but with non-monogamous relationships, communication is definitely the foundation. So being honest and transparent in just explicitly expressing your feelings without any prompts or without any questions. And then being honest, if your partner is having questions about what is going on for you, being truthful about your feelings, your thoughts, your desires, your wishes, your needs, and then also finding the right timing to do so. Also, when speaking with your partner about possibly exploring a non-monogamous relationship, consent is key. If consent is not given, then it's unethical. Straight off the bat.
Okay.
So consent is number one when it comes to actually living a non-monogamous lifestyle.
Okay. So living an ethical one.
An ethical non-monogamous.
Yeah, right, because I think that's important, because a lot of times, the first discussion, first off, I think I agree, talking to your partner, being transparent, But I also think for a therapist, one of the main skills is to be non-judgmental.
Absolutely.
It's to come from an approach of not judging, and that should be yours in general when you got one of your skills, hopefully, right? However, I think in this area, especially, our own bias come up, our own different areas around what we think relationships are, how we see relationships, how we've been structured to believe within our faith, right? There's so many factors as a therapist that we need to consider before we even offer the opportunity to really support the client about our own stuff. So I think, what are some ways for us as therapists to evaluate what our biases are in these areas?
Definitely. So one thing, and what we're doing in the webinar, one of the very first things we're doing is what comes to your mind when you hear ethical non-monogamy. I know the first time I heard it, it was like, ooh, sort of like, no, absolutely. This is something that shouldn't, like, it's an absolute no. And it may be an absolute no for you personally. However, if we're talking about you or a person as a therapist, or you as a clinician, or as a social worker, or anyone in the mental health profession, you very well may run across someone who is practicing or is interested in this lifestyle. And in order to support that client, you definitely have to check your own biases. You definitely have to approach it with a non-judgmental tone, and also be honest with yourself. If you really cannot get over that hurdle, being honest and open with your client that I may not be the best person to support you. And definitely giving them to someone or guiding them to someone who can truly support them, because it is a lifestyle. And it is something that some people. It also can be an identity. When we talk about polyamory, when some people identify as polyamorous, that can be an identity, not just a lifestyle. So we definitely don't want to cause any harm to anyone. Definitely within our code of ethics, we don't want to cause any harm. So it's important to make sure that if you are not the person to help or support this person, that you are definitely guiding them to the person who can. If you do feel as though you can, but you don't feel as though you know enough, educate yourself, get the research. There's plenty of research out there. There's plenty of education and support about the different communities, about the different types, about what it means, about different strategies that you can help with. So definitely educating yourself as a clinician to staying on top of, well, how can I best support a client who may want to experiment with this lifestyle?
And I think that's such an important thing to remember, that you can learn more and more and more. And as therapists, we should never close the door on knowledge in any of the areas that we are even experts in at this point in our careers, or at the different points in our careers. And so I think I want to just close with saying, thank you for this awesome information. But what could be your takeaway, or what should be their takeaway from our conversation today if they had to walk away with one main thing?
I think the main thing that you all should definitely take heed of is that you don't know who's walking through your door and what their needs may be, what their desires may be. And if someone is being vulnerable enough to disclose that and express that to you, then they are looking for support. And the best thing we can do as mental health professionals is support that person the best way we know how. Whether it's giving it out to someone or doing a referral to someone who may be more equipped to handle this situation, such as other mental health professionals, sexual educators, sexual therapists, or if it's doing the research and supporting and guiding our client through that with different resources and support as well.
All right, so that's our show for today. Again, we will be back, like I said, maybe twice a month. I don't know the dates yet. We are still working on that. So hopefully you enjoyed, and we will see you in a few. Be well.